More than 88 million American adults have prediabetes. Of that number, over 84% have no clue they even have it. Even you can be at an increased risk of type 2 diabetes, heart disease, and stroke. With prediabetes, it can be a term that causes you great stress, but while it seems scary, it's an opportunity. A prediabetes diagnosis can mean you have the opportunity to take control of your health before severe consequences. The thing is, with so many adults living with it undiagnosed, how are you supposed to know? That's what we're going to dive into today. We have the top 12 early prediabetes symptoms that you need to know so you can take the opportunity and get control now. If you're looking for more interesting educational content like this, let us know by liking the video and subscribing to our channel for more. Make sure you turn on notifications so you don't miss a single video. Of course, before we dive into it, the information in this video is educational and cannot constitute medical advice. We are not doctors. If you suspect yourself to having the following symptoms, your best course of action is to contact your doctor. Make sure you watch till the end, as the symptoms can be really surprising. Additionally, at the end of the video, we will tell you what test can help you check if you have diabetes. So with that, let's get it on. Well, you may be wondering, what is prediabetes exactly? Prediabetes is a set of symptoms seen as a warning to type 2 diabetes, not necessarily an inevitable diagnosis if treated and followed up. What it means is that your blood sugar levels are higher than usual. Following a diagnosis like this, you can make a series of lifestyle choices to reverse them or treat your body accordingly. The thing is, though, you need to know what you're experiencing. With unknown causes and triggers, all you can do is be aware of the signs of prediabetes and be knowledgeable enough of your own body. With the information you gain today, you can hopefully be better informed to reach out to your doctor if needed, or feel confident that this is not what you're experiencing. Number 12. Dry mouth. People with diabetes most commonly report dry mouth, even if the full correlation isn't entirely understood. It may be related to high blood sugar or hyperglycemia, especially concerning diabetes, though some symptoms include a mouth that is continually dry or cracked lips, sores or infections of the mouth, trouble chewing or swallowing, or a rough and dry tongue. Number 11. Mood swings, irritability. A growing amount of research indicates a correlation between moods and blood sugar levels and the inverse reaction it may have. Mood swings and irritability can mean many things, but it's one of the symptoms that may be an indicator of your uneven blood sugar levels. Most people report feeling cranky when they're hungry, but paired with an increased hunger or excessive fatigue, it can be a signifier of things to come. Number 10. Increased hunger or thirst. As your body is dealing with increased blood sugar levels, someone with prediabetes may also experience an increase in both hunger and thirst. Often, this increase cannot be satiated with normal eating or drinking, or can feel impossible to meet your own needs. Your body is producing more glucose than it needs. Your cells can no longer absorb it. As a result, your body looks for more and more fuel, causing this persistent need. Number 9. Excessive urination. When kidneys can't keep up with the amount of glucose in the body, often it's allowed to go into your urine. In many, this can cause an increase in urination. It's also known as polyuria and may be an early detector or sign that your blood levels are high enough to spill over into your urine. Number 8. Unexplained weight gain or loss. Whenever you experience unexplained weight gain or loss, it may cause concern. Especially in the case of diabetes, you may notice you're losing weight despite eating the same amount or more. It may not specifically mean diabetes, but it is one of those warning signs to watch out for if you're experiencing other symptoms. With this extra glucose in the body, in the case of diabetes, it may end up in your urine, which can cause weight loss even if you're eating more. Researchers have found that people who experience weight loss that they are not expecting before the diagnosis may have more complications down the line, like eye or kidney disease. Number 7. Tingling or numbness. Tingling or numbness concerning diabetes is a rare symptom that usually develops over time. It sometimes shows after years of living with the disease. Numbness often shows in the hands, fingers, feet, or toes, and is a sign of nerve damage or diabetic neuropathy. It may be rare, but if it happens frequently or without warning, it can be the first step to recognizing the signs for some. Number 6. Slow healing wounds. Over time with diabetes, your blood sugar levels will narrow the blood vessels and slow circulation. This in turn restricts the needed nutrients and oxygen levels needed to help heal wounds. Prolonged high blood pressure levels usually cause this. Still, if you're noticing that your injuries last longer or seem more severe without just cause, it might be worth assessing the possibility, especially when mixed with other symptoms. Number 5. Dry, itchy skin. If you begin to notice abnormal changes in your skin, it's always worth mentioning. In a possible diagnosis, you may be dealing with itchier skin early on. It can be caused by infection, dry skin, or simple poor circulation, all of which can be tied back to diabetes or linked to a pre-diabetic symptom. Number 4. Dark, thick skin patches. Another example is the darkening of skin, especially around the armpits, neck, and groin region, as well as the potential of thickening of these skin patches. The excess of insulin in the blood is the cause of this, as insulin resistance is the primary precursor to type 2 diabetes. If you notice skin changes that feel out of the norm, it's always worth getting it looked at or taking note. Number 3. Frequent infections. Alone are always causes for attention or alarm, but they're seen in everyone for different reasons. However, people with diabetes experience them more frequently than others. When the blood sugar is too high for your kidneys, it can filter out through your urine and cause urinary tract or yeast infections. Gum or skin infections are also common. You may notice bacterial infections, such as styes in or near the eyelid, boils on the skin surface, and infections of the hair follicles or around the nails. Fungal infections happen more frequently too, such as red rashes or tiny blisters, more often found in warm, moist skin folds, like under the breast, around the groin, in the vagina, around the nails, or between digits. Any infection may cause for alarm, but assesses this as symptoms paired with others. Number 2. Fatigue. Extreme fatigue is one of the most considerable warning signs or symptoms of diabetes. Researchers have studied but never found a concrete link. If you experience more distinguished, pervasive fatigue symptoms, your body may not be processing the fuel you're putting in properly, causing it to fluctuate significantly in blood sugar levels. Many co-occurring conditions can cause this fatigue, including dehydration, poor sleep quality, obesity, lack of physical activity, deficient diet, psychological issues, or imbalances in hormone levels. While there is a fair amount of overlap between these symptoms and conditions, the link is still unclear and reportedly challenging to study in relation to one another. If you notice that your fatigue seems impossible to get control of, no matter what you try, it may be worth looking deeper into see if it might be a symptom or not. Number 1. Higher than normal blood glucose levels. The most common identifying signifier that you are potentially experiencing prediabetes is the higher than normal blood glucose levels. Monitoring your blood glucose levels for an abnormality is the top answer because it is the only thing that can help you gain a diagnosis. Being able to test your blood glucose levels on your own can be a great place to start, using an at-home test if you feel like something is wrong. Bonus material: How to diagnose diabetes. To diagnose type 2 diabetes, which is the most popular type of diabetes, you can do the A1C blood test. This test measures your average glucose level in long term, showing average results for 2 or more months. A1C test indicates how well you are managing to keep it under control as follows. Below 5% is normal. Anything between 5 to 6% indicates prediabetes. And if this number reaches 7% to 10%, in 2 or more tests indicate diabetes. It's not always easy to know if you have diabetes. The A1C test can be expensive and time-consuming, so sometimes doctors will use other blood glucose tests instead. The other way of diabetes diagnosis is a test of glucose and insulin levels in the morning after 12 hours of fasting. The normal range of glucose is 60 to 100 milligrams per deciliter, and for insulin, below 10 micrometers per milliliter. An important indicator is also HOMA-RI that shows the correlation between insulin and glucose and warn you about insulin resistance. What is a pre-diabetic stage? HOMA-RI normal range is everything below 2.5. That's all for our video on pre-diabetes signs and symptoms. As always, the information in this video is meant to be educational and informational, not a medical diagnosis. If you think you have these symptoms, Your best bet is to go to the doctor and get tested properly. Prediabetes is a warning sign, not a curse to live with. So you can reverse these symptoms by being proactive with your health. If you found the information in this video helpful, and if you're going to want to see more videos like this, leave us a like and make sure you subscribe and turn on notifications so you never miss a single video. Check out also other videos listed in the description below. See you soon.